our last talk today before moving on to breakout sessions, where I'm sure everyone will happily share their ideas. Our last speaker today is Dr. Andrew Oberle, who is not only a trauma survivor, but has taken that experience to move it forward, and I'm really excited to hear your talk today.
Hi, everyone. Not a doctor quite yet. I'm a doctoral candidate at St. Louis University, but will hopefully be finished sometime this fall semester. My dissertation focuses around the effects of trauma survivor support programs on patient experience. And that's actually transformed into the new role that I have with BJC Healthcare in St. Louis and Barnes-Jewish West Kenny Hospital as their new patient experience partner. So I'm really excited to take all these things that I've learned working with trauma patients and trauma providers like yourself, and this passion I have for improving that human experience in healthcare and kind of meshing it all together just so we can make sure every interaction that our patients have when they come through our doors and visit our clinics and are out in the community have the best experience possible. I'm so grateful. I'm always so grateful to be able to speak in front of healthcare professionals like yourself, trauma care professionals, especially whether you're a clinician or a researcher or dabble in a bit of the both, because it's people like you who have dedicated your entire lives to helping survivors like myself not only have a second chance of living, saving our lives and bringing us back to this world when things go wrong in our lives, but through your compassion and your skills and your expertise, giving us a second chance of living a thriving life after we go through such a horrible experience. So I'm going to share my story with you today. It's a little bit of my survivor story that has, as Dr. Ho said, has transformed into this life of serving others when I had no plan on doing that as a young adult. And then I'm going to talk a little bit about resilience, not so much my resilience, it's the people like you who helped foster this resilience inside me when I was in my deepest, darkest moments after getting injured, but also the people I've met along the way who just embody this term of resilience, who have inspired me to take my story and not keep it to myself, but do more with it. Then I'll talk a little bit how I actually got into this whole world of diversity, equity, and inclusion, and it started this life of doing what I can to advance equity for people with disabilities especially, but being involved in the whole world. Then I'll talk about some of the gaps in trauma research and care related to working with people with disabilities, and then how we can break down those barriers and change the way that we do things by challenging the biases that we may have when interacting with people with disabilities. And then finally, talking about engaging community, whether it's your patients or your families, researchers, providers, or anybody out there who's involved. And then talk a little bit about my experience and a call to action to you to get more involved in policy and systemic changes to help other people. And then finally, I'm just going to end with a call to action. So first, my story goes back to second grade. I was in Miss Rosso's class. She had just come back from Africa from the previous summer, and one of the class days she taught us about Jane Goodall and told us all about the cool work that she was doing with chimpanzees in Africa. And for some reason, that just stuck with me. And I went home that afternoon and told my mom, I want to work with chimps the rest of my life, just like Jane did. And so I led the rest of my life, going to the St. Louis Zoo. If you've been to St. Louis, we have an incredible zoo. We have a big chimp group there, and I would go every chance I get. I'd run to the glass. I'd sit there and watch the guys. Started volunteering and then working at the St. Louis Zoo. And then in my senior year of college, after I'd gone through a couple years of working on my anthropology degree, I traveled to Hawaii and got to do my very first internship at the Honolulu Zoo, working with the chimp group there, and was just blown away and just, kind of solidified that love that I had for them my entire life. Even when they, spit at me with water or threw their poop at me, I just thought that was the coolest experience in the whole world. and it just made my day. But this life, when it led to my my trip to South Africa to do my master's research in anthropology, one afternoon, a couple of the big guys got out of their enclosure and tore me to pieces. Now, the chimps that you see on TV are usually pretty small. A lot of times they're females. They're cute and cuddly. You want to hold them. They make funny faces. But when a chimp, male especially, gets 5, 6 years old, they start bulking up, buffing up, get a lot more aggressive. That's just the way chimps are. And by the time they're 10 years old, they can be 4 to 6 times the strength of a man the same weight. They may be 4.5 feet tall, but they can weigh up to about 200 pounds. And these guys are just pure muscle and rage. And this afternoon, the electric fencing didn't hold them back, and they jumped at me, tackled me to the ground, and I was alone trying to survive for about 20 to 30 minutes before anybody could get to me and rescue me from the scene. I remember so much of the attack. I remember first trying to fight my way out by picking up a stick and hitting one of them, and they just took it away and threw it to the side. I remember reaching down and trying to pick up a rock that I could probably throw at them, and when I came back up, the rock wasn't in my hand. And then I looked, and I knew that was because my fingers weren't there either, so I wasn't able to pick anything up. At that point, I tried to run, but just trying to get away, I would get tackled to the ground, and they would bite and tear pieces off of my body. One of the joys of trauma is being able to relive these experiences over and over and over, whether you're brand new to the experience or, like me, 11 years out from this happening. This happened in 2012 to me. But if I close my eyes, I can still feel Nicky. He was one of the chimps who got at me. I can still feel his hot breath on my face right before they bit off my nose. I can still feel a crunch feeling as they took a chunk out of my occipital bone back there. And, I remember watching them pin me down, and I have my fist clenched, just trying to protect my body, and they would just peel them back one by one. This little piggy went to the market, chomp. This little piggy went to the market, chomp. I remember screaming for help. I specifically pleaded to these guys, Nicky, Amadeus, please stop. And that wouldn't work. I remember screaming out, why hasn't anybody come yet? And they just kept at it. But after they were able to rescue me from the scene, I went in the back of an ambulance. The paramedic asked if I knew where I was. I said the name of the sanctuary I was at, and then everything went black. I woke up 2.5 weeks later in an intensive care unit in Johannesburg, where I spent the next 2 months on a ventilator for about a month. I was in the ICU there altogether for about 2 months before being flown home to St. Louis to receive 4 more weeks of acute care at St. Louis University Hospital, 6 more weeks of inpatient rehab at the Rehab Institute of St. Louis, and then finally got to go home to my family and my friends and my dog, and started that long journey of outpatient appointments, several a week. I've had 28 surgeries altogether since all this happened to me. I've gone through just hours and hours of horrible dressing changes, countless hours of different therapies. But everything started going really well for me. Within a year, I was walking a mile. I was getting my face back out there in the world. I was no longer afraid to show my face in public because people like you were giving me that opportunity to keep going. So this was me here in the hospital in South Africa. This is what my mom, after being told to get to South Africa as soon as she could, but not to have her hopes up that her son would come back home alive. This is what she had to walk in and see, and she sat by my bed every day while I was there, while I was in acute care, while I was in rehab care, until I got home and said, Mom, it's okay, you can go back to work now, I'll be okay. I was able to even smile while I was in rehab because, when we're debilitated, we take that even ability just to stand up for granted. And there I was, able to stand up at those parallel bars again after not being out of my bed for over 3 months. So that's my smile there with my PT Karen. And this is one of these healthcare professionals that I mentioned who just not only cared for me once I got home, but became this second mother to me. This is Helen. She's the emergency nurse that I owe my life to. My third daughter's middle name is Helen after this angel here, but she was there with me when I crossed that finish line after a mile walk a year after surviving. So all this led to really great opportunities. In just 3 years, I was invited back by St. Louis University to use my experience as a patient and this passion I had for wanting to thrive after my injuries, not just survive, and take that and help them build an institute to support other trauma survivors. And so that's what I had been doing at St. Louis University for years, starting in 2015. And it was because of people like Tony, who inspired me to get back out there. He was a nurse that came to my house every day for several months to change my dressings. He'd, peel them off these horrible wounds and sniff them to make sure they weren't infected. He helped me take a shower, almost every day. But more importantly, he was this friend that was there to care for me and talk to me about the fears that I had, the pain that I was going through. I remember sharing with him one day that, how is anybody ever going to be able to love me when I have these bits and pieces missing from my body, when I'm scarred from the outside and on the inside? But he was there to assure me that things would be okay. And, I still remember the day that I got to tell him that I met a woman who is now my wife and the mother of our 3 daughters. So Tony was right. I was wrong, and I can't thank him enough for letting me get back out there. I also was inspired to take my story and not keep it to myself, because I heard this gentleman here, John O'Leary. He's a famous motivational speaker in the United States and internationally. He was in a bad burn accident when he was a little kid. I saw him speak when I first started working at SLU. And that day I decided that sharing my story can be such a powerful tool to others, whether it's to thank you all for what you're doing and remind you that the work you do is so important in lives like ours, or maybe to inspire somebody that they can get through the tough time that they're going through. And then other people that inspired me to serve, like my friend Genva here, who after a bad motorcycle accident lost her leg, had a rough time in the hospital, but I visited with her in the hospital several times a week after she got out of the hospital several times. And then I was there on her first hospital clinic visit to the prosthetic when she got to try on that prosthetic for the first time and stand up on her 2 own feet again. And to me, resilience, I love this quote by Nelson Mandela, not to judge me by my success, but by how many times I fell down and got back up. And I like this quote especially because I feel a special connection to this wonderful man. I found out not a couple of years after leaving South Africa that my critical care doctor in South Africa ended up taking care of Nelson Mandela in his final days. So I have this connection with him, and his words on resilience just made, really, really bring it home for me. But then I got invited to start doing work in DEI, and I wasn't quite sure at first. I got invited to join the medical school Council on Diversity, Equity, Inclusion, and being new to all this, I was kind of had this thought, what do they want a young, white, cisgendered, heterosexual male doing on a diversity, equity, and inclusion committee? And then the person who invited me kind of looked down at my leg, and I was like, oh yeah, I do have this disability here. And they said something really important to me that still sticks with me to this day. And one reason I'm so grateful I'm here is we want to make sure that as we work to advance diversity, equity, and inclusion in our medical school, the voice of people with disabilities is represented, and you have a powerful voice, and you're able to share your story. Don't let us forget that this group also needs help. And that's why I'm so grateful to be here. to be part of that voice in this room as we've gone through all these presentations today, which have been so wonderful and so impactful and so insightful, such powerful voices in this room. We also got to make sure that we're not forgetting about people with disabilities as we try to advance our care and our research as well. So I started getting invited to do these talks. I got to give a great commemoration talk for the American with Disabilities anniversary a couple of years ago at St. Louis University. So that was really my jump into this whole world. I dreamed on scoop and chimp poop the rest of my life, and here I am representing people who have gone through trauma. So while I worked with chimps who had gone through these traumatic experiences and were rescued and put into sanctuaries to rehabilitate, now I was working on the other side. I guess I just jumped species, but I just wanted to help people. And this work I've been given the opportunity to do has been so great, and I'm so thankful for it. So getting into this world, I started exploring some of the gaps in trauma research and care, and started noticing them when I'd visit patients in the hospital. And I came across several things that really highlight why this work is so important for trauma professionals especially. So traumatic injury is one of the main causes of disability for people, as well as the largest cause of disability-adjusted life years in our country. So the patients that you work with, whether they come in and they have spinal cord injury, traumatic brain injury, amputation, or some fractures that limit some form of their functionality, as well as, roughly according to the CDC, of our people in the United States have a disability. So many of the patients that you'll see in your clinics or in your research studies are going to have a disability. So it's important that we make sure that's always top of mind when we go and conduct these studies or walk into that room to start providing care to an individual. So compared to the general population, people with traumatic injuries, they report more pain, limited physical and social functioning in their lives. 75% of trauma survivors report debilitating pain, and half end up with some sort of disability and an inability to return to work. I know that was talked about earlier, and when you have that inability to work, when you have this debilitating pain, then your social functioning gets affected, your mental health, your quality of life all goes down, and it just leads to this cascading effect that can really cause damage to an individual's life. And also leading to things like post-traumatic stress disorder and depression. And these are also debilitating conditions that really affect the way that people are able to function in daily life. So these things are very important, and these are gaps that aren't always recognized when we're doing research or meeting with patients. We know that they went through a traumatic injury, but the whole time I was in the hospital in South Africa, in St. Louis, all my doctor's visits, nobody asked if I wanted to talk about what happened to me. Yeah, they would ask me, they would ask me how I'm doing, but I would say, oh, doc, my wound's healing fine. Or, yeah, I was able to walk a few more steps today, but nobody actually said, no, how are you really doing? And that's a big gap that we have. And so we need to recognize that you crashed on a motorcycle, you have a spinal cord injury, but how's that affecting your mental health? So please never forget that. Never let it go in a visit. I know our time is all crunched, but always take that extra few seconds to see how somebody's doing, really doing. And then I found some other things, and this is related a lot to trauma care, things that we know versus that we don't know. So as you can see here, not a lot of clinicians really understand their responsibilities under the American with Disabilities Act. And that's something that everybody should be a little bit more educated on, because it could lead to poorer care that you're providing. It could even lead to worse things like complaints and grievances and lawsuits and things like that. More responders didn't know who actually determined these accommodations that are needed in a hospital or a clinical setting. One funny thing I found, you all knew who actually pays for them, but didn't know where these accommodations should actually come from. And a lot of providers thought, they're at least at risk for some sort of legal intervention because they might not be providing proper care to people with disabilities. So sometime in your learning, as you go back to your home institutions, take a look at the ADA and maybe educate your staff and your clinicians and everybody on what are these accommodations, what are our responsibilities under the ADA. This was another study that I found incredibly shocking, sad. This was an anonymous focus group where basically specialty physicians said they don't really want to care for people with disabilities for one reason or another, whether it's because they feel they may be at risk for doing something wrong and then getting sued for it, or because they don't want to pay for the accommodations. So these are actual comments from physicians who, under the protection of anonymity, said these things. And, when you take that oath in medical school, do no harm, that applies to everybody. And when we see studies like this come out, where care is substandard, where medical offices aren't accessible, where doctors don't treat these people with respect, you're violating your oath, in my opinion. But I also know that it's a difficult thing to address when you're doing it. This next study that I found that talks about technical standards in medical school not being up to par with the American Disability Act. There's a gray area, a fine line there. Physicians need to be able to do certain things when they care for patients, but then how do you reconcile that with people with disabilities? How do you, people who may need extra time studying, or maybe who can't stand over that cadaver, for hours on end, learning the intricacies of the human body. So how do you deal with that? So, another thing, when you get home, take a look at your technical standards in your medical schools and see what you can do. And as other folks mentioned today, when patients come in and are looking for care, looking for somebody to trust, that care is so much more effective and meaningful when it's somebody who looks like them. And when we're not allowing people with certain disabilities to advance through medical school and become doctors because of technical standards, then those people with disabilities that come in may not feel that sense of welcomeness that they potentially could. But again, it's up for discussion, because I know there's things that you all need to be able to do in order to provide appropriate and good care. So in terms of breaking barriers and challenging biases, I think the first place, you all are exposed to a lot more people with disabilities in the general public, but we need to take a look at where our biases were first originated, and these start from the time we're kids. So, we've actually heard about FDR a lot today, but this is, we learn about FDR really young in school. Here's this person who was in a wheelchair, but did great things, became president of the United States. That's a great story. It's an inspiring story to some, but that's just one example. But we got exposed to a lot of other things that made us, maybe we don't know that these biases are inside of us, but we saw cartoons where amputees were villains who try to ruin everybody's fun and, get rid of the lost boys in Peter Pan. But, for something like that, for example, I know as an amputee myself, and I can't speak for others, but, now sometimes, you kind of get that side eye. We were also taught that people with disabilities can be very funny, and the things that they do are okay to laugh at. I was a big fan of South Park growing up, didn't realize how horrible that some of those episodes might be. This picture was taken from an episode disgustingly titled Cripple Fight, but we're all supposed to laugh at that. So these biases get built up in our minds. Same with this guy from Something About Mary. People with disabilities are made into jokes, and they're also seen as these superheroes. I lost my sight, but now I have super hearing and can navigate the world and fight crime. A patient I worked with who lost their sight, one of the first things they said to me is, no, I don't have special powers. So it's on their mind that people are asking me and them these questions. Or people who have, mental health conditions, schizophrenia, are not to be involved in part of society. Instead, they can become homicidal psycho killers like the Joker here. So these are all things that we see in popular culture that implant themselves in our minds. And these are stereotypes that we need to break down because people with disabilities are just people. And that's how we want to be treated. And because we've been given these examples our whole lives, it's difficult to take that out. So always be cognizant of what you're seeing there. So when you get home, work to foster that inclusive environment. If you have patient-family advisory boards, start inviting patients back and get their input on how you can be better care providers for them. Find ways to not just be their doctor. Marcy here in the middle isn't just the motorcycle accident in room 600, but she is Marcy, a school teacher who just wants to get back to teaching her kids. Ben here is an example as well. I'm a big proponent of peer support programs. I know there's some fellow peer support people in here. It's such a powerful tool that helps any of your patients, any of your trauma patients, feel more welcome in the healthcare setting, and helps them feel like they're part of a community that they can then develop more trust. And so I was engaging the community through research. I started my doctoral program. I joined the board for the American Trauma Society, and shout out to my fellow ATS members in here. It's good to see you all again outside of Zoom. But these are ways that I've been able to take my story, use my voice, and do more to help other trauma survivors. I've even got to take my story to Capitol Hill, lobby some of our congressional representatives and senators to provide more funding to our trauma centers. And that's can help people with disabilities, can help people without disabilities, can help people from every group, every single person. If we can get more funding to our trauma centers, we can take the time to provide more compassionate one-on-one care. We can pay for more trainings that allow us to take these classes to understand our biases a little more and learn ways we can be more compassionate. I'm also involved, like with Maggie back here, with this So Kids Can Move, so we can make sure that insurance companies aren't discriminating against people who just, we can maybe get one prosthetic to get moving, but after that, what if we want to go out and be more active in our lives? Insurance is going to say, no, you already have one, so I'm sorry, you're just going to have to make do with what you have. And just a call to action, the Platinum Rule, I'm a big fan of this. Don't treat others the way that you want to be treated. Treat them the way that they want to be treated. And that takes your responsibility of meeting these people, getting to know them as people, treating them with respect and dignity, finding out what their needs and preferences are, and then equating that to the way that you work with them. A really great, easy way to be more inclusive for people with disabilities is, for example, with your schedulers or your researchers. Just every time somebody calls to make that appointment, just ask, are there any accommodations we can make for you when you come into your appointment? Super easy thing. It takes 5 extra seconds on a phone call. They may say no, they may say yes, but you're already opening that door for them to let them know that you respect them as an individual, and you want to make sure that they have the ability to receive the same care as everybody else that comes through their door. And then finally, this is something that a disability rights leader once said to me, something they try to teach and keep in mind all the time. Just every day ask yourself, have I excluded anybody recently? It keeps that top of mind and keeps you thinking and keeps you growing and learning and pushing down those biases that you may have picked up growing up or, brought in as you, grew professionally and let you remember that people are people first and that you need to be there for them. And so again, I just want to thank you for all you do. I know you wouldn't be here if you didn't care about this issue, but there's a lot of providers and researchers out there who are not here. So please, everything you've learned in this room today, take it home with you, spread the word, make this top of mind in your cultures, and so we can, next time the conference can be twice as big, and then 3 times as big, 4 times as big, until this is I heard Dr. Fakri say this should be part of every single trauma conference, no matter what the topic is. There should be a section at least on this issue here. So we need to keep this top of mind. And again, thank you all for being here.